Hello everyone. I am starting a video series on multiple choice question, clinical based questions. So whenever time permits, I will upload the MCQs. So this is the MCQ of day 1. So let's start reading the stem of the MCQ. Whenever in exam you are having the clinical based question, read carefully. So I'm reading now. 1-year-old boy brought to the OPD by the mother and chief complained of trauma one day before. Then child had developed the hematoma in morning after 18th hour of injury. On interrogating his mother, child had the history of umbilical cord stump bleeding just after birth. So in perinatal history, this is very significant history. There is also history of delayed separation of umbilical cord stump beyond 4 weeks. So this is the history part. Now in investigation, hemoglobin 9.4 gram per dl. So child is having mild anemia. Total WBC count, leukocyte count 10,500 per mmq. It is normal. Platelet count 1.59 lakh per mmq. It is also normal. Prothrombin time 12 seconds. INR 1 also normal. PT is normal. Now activated partial thromboplastin time 24 seconds. Also normal. So APTT is normal. Now bleeding time 3 minutes 40 seconds. This is also normal. Now in clot solubility test, in presence of 5 mole urea, clot was dissolved. So clot solubility test is positive. In normal child, clot will not be dissolved in the presence of 5 m urea. So it is suggesting. Now what is the most probable diagnosis for this child? So let's discuss the history part and all the options. So in history part, first point is child had trauma one day before, and after one day child had developed the hematoma, not immediately after injury. It is a significant part. Now when asked in the perinatal history, there is a history of umbilical cord stump bleeding, delayed separation of umbilical cord stump. Now in investigations, all the investigations, PT is normal, APTT normal, platelet normal, BT normal, except clot solubility test, which suggests that clot was dissolved. So now in the first option, factor 10th deficiency, PT, APTT both will be increased because factor 10th is the common pathway. So its deficiency will lead to the prolonged PT and APTT both. Now in the factor 11 deficiency, PT will be normal while APTT will be prolonged. So this is also ruled out, and child will have the mild bleeding manifestation in the factor 11 deficiency, also known as hemophilia C. While in the factor 8th and 9th deficiency, child will have the moderate and severe manifestation of the bleeding, and the lab report will be same as the in factor 11. PT will be normal and APTT will be prolonged, except bleeding manifestation will be mild in factor 11 while severe or moderate in 8th and 9 deficiency. Now in the C option, factor 12 deficiency. In this also PT will be normal, APTT will be prolonged. But in this, patient will remain asymptomatic. No manifestation of bleeding will be there. Except in routine investigation or patient is posted for the operation. During that time, these reports will be there. But patient is not having any bleeding manifestation throughout the life. Patient remain asymptomatic. Now in the factor 13 deficiency, PT, APTT both will be normal, as in our case. PT, APTT both are normal, and clot solubility test is positive. So all these three options are ruled out according to the reports and according to the history part, because In the deficiency of factor 10th and 11th, child will have the bleeding manifestation immediately after the injury. So hematoma will form immediately after the trauma, not after 18th or 20 or 24 hours. It is characteristically seen in factor 13 deficiency, delayed bleeding manifestation. So answer is D, factor 13 deficiency. So the learning points, whenever there is a history of delayed bleeding tendency, hematoma hemorrhage characteristically present 12 to 36 hours after trauma or surgery, means child is having 13 deficiency. History of umbilical cord bleeding at birth is characteristically present in 13 deficiency. When you will go for the platelet count and coagulation profile, you will find normal platelet and coagulation profile. PT, APTT, platelet counts, BT, CT, all will be normal. Then you have to go for clot solubility test. It is highly sensitive and specific for factor 13 deficiency, in which clot will be dissolved in the presence of 5 mole urea. Now, what are the differential diagnosis of factor 13 deficiency? When all the investigations are normal, first we have to go for clot solubility test. If it is suggesting, then factor 13. If clot solubility test is also normal, then we can go for chromogenic assay. It suggests alpha 2 antiplasmin deficiency, in which all coagulation profile platelet count will be normal and child is having bleeding manifestation. And sometime in mild case of hemophilia and von Willebrand disease also, child may have the all screening tests as normal. For further learning, you can watch the video Bleeding Disorder Part 1 by 4, in which general approach to the bleeding disorder is explained. I will share the link in description box also. So thank you so much.